Okay.
All right, let's go ahead and begin.
All right. Well, welcome everybody to this education information session regarding the 2024 benefits offering for the ExecAA members. One of the things that ExecAA likes to do for its membership is to provide assistance around running your business. My name is Jim Lodge. I'm with RPS Benefits by Design and have worked with ExecAA on this program. Presenting with me today will be myself, obviously, Stan Thorne, who is also with our organization, RPS Benefits by Design. And we will also be hearing from Jim Hoggett, CEO of the American Association of Executives. So with that, I'll turn it over to you, Jim.
Well, good afternoon and welcome, everyone. So just a bit of background about the American Association of Executives, or the acronym ExecAA. We started ExecAA back about 4 or 5 years ago. And ExecHQ, which is the company that I'm also a CEO, we're a global consulting firm. And we started ExecAA for a number of reasons. One was to provide training and education and other services to executives across North America. But as part of that, we wanted to offer an array of services, medical benefits, dental benefits, discount programs, and various other things to executives and other professionals, 1099 individuals that are in the United States. So today we're going to talk about the plans that are available for health, dental, vision, and other areas. There is no cost at all to join the American Association of Executives, and just about anyone can join. So with that, I'll pass it back to Jim Lodge. And Jim and Stan, welcome, and I appreciate you taking the time.
Thank you, Jim. So as Jim mentioned, we're going to be actually diving a little deeper into the various, the total of the benefits program that we're offering for 2024. I'll be talking about medical plan options, which there are a variety to meet both budgetary and coverage needs. And then Stan will be presenting on the various ancillary coverages. If you have questions, and I'm sure you might, please make note of them. Our presentation is going to run about half an hour, and then we'll have plenty of time on the backside for questions and answers. The reason I ask you to please hold them is because I think as we go through the presentation, we may well answer them as part of the presentation. So with that, just give you a quick overview of the various partners that we have been able to secure for this program. For the medical plans, we're going through an organization named America's Choice. And as I said, we'll have 5 different, well, I didn't say this, I guess we'll have 5 different plans to choose from. For the dental and vision, we've been partnering with United Healthcare for the last several years for those coverages, and perhaps some of you may already have that coverage, but it's going to remain with United Healthcare. We've got some new coverages that we're offering this year through Combined Insurance, which that name may not be familiar, but they are a Chubb company. And Chubb Insurance certainly is well known, particularly on the commercial side, but this is their worksite benefits company, which offers life insurance, disability, accident, critical illness. If you have some very particular needs, particularly larger term or whole life insurance needs or real high income disability needs, We've partnered with Northwestern Mutual for those. And then Legal Shield is one of the leading, probably the leading company in the United States around legal assistance and identity theft protection. And we've are partnering with them as well, along with the ASPCA pet health insurance. That's always it's becoming a very popular benefit on the corporate side, and so we wanted to make sure and offer it to the membership as well. So with that, I'll jump into the medical plan options that we've secured for 2024. And as you can see, there's sort of a variety based on your tolerance or sort of comfort with different risk models and that kind of thing. The first two, the $2,500 deductible plan and the $5,000 deductible plan, are national PPO options, very reminiscent of what you would typically see in a corporate environment. Some of you may already have an HSA or desire to have an HSA integrated plan, and we are offering one of those at a $5,000 deductible. And then there are a couple value plans, the 500 America's Choice Value Plan and the 100 America's Choice Value Plan. What those numbers mean is that there is the plans carry zero deductible. They have essentially operate like a traditional PPO on the front end of the plan, and to serve the needs of the vast majority of people that would utilize a medical plan. But that there is a cap on the benefit. So and in the case of the 500 America's Choice Value Plan, it's $500,000. And in the case of the 100, it's $100,000 of benefit. So pretty much those plans operate just like any other plan, but for something really catastrophic, there would be some potential exposure. But back to the $2,500 and $5,000 traditional PPO plans, you know, that the costs of these are, we think, very competitive when you consider a high income earner on the alternative, which is the ACA marketplace through the federal government. In the case of the $2,500 deductible plan, you can see an individual member, dependent on their age, can be as low as $688 a month, up to $2,100 for a family, for perhaps an older member. But we've got a chart. The next chart is going to be a bit of an eye chart, but I want you to see this. And you can see that there are the ages on the left-hand side ranging from 18 to 62. I will mention that these particular plans are only go up to age 62. So if you're in that corridor between 63 and 65, or if you are indeed Medicare eligible, there are alternative options that we can help you with, but they are not included in this particular set of plans. But we can, I like to say that we can help just about anybody. So you can see, if you read this chart, you've got the three age tiers on the left-hand side. You've got the 5 plans across the top, and then you've got the various coverage tiers: member, member plus spouse, member plus children, and member plus family. So the way to read this, as an example, I'm 57 years old. I would probably cover myself and my children, and I'm comfortable with a $5,000 bronze plan. And if you kind of, you know, take a look at the rows and the columns, you can see that I'd be paying $1,052.28 a month. So that's kind of how to read the chart. And I'll just take, you know, a brief 10 seconds or so to let you kind of take a look at that. And as I do that, I'll mention this presentation will be available on the ExecAA website, as well as the recording of this, as well as the deck itself, so that you can, it's not like you gotta take a screenshot right now, but do be aware of kind of what you might be comfortable with, and kind of have an idea of what the costs are associated with it. One thing I would mention is for those value plans on the far right hand side, there is no age banding. Basically, the underwriting is done in such a way that it's the same price regardless of your age, just by coverage tier. So with that, I'll move into the next piece that is always of concern, which is the details of the plan. So these various plans, one thing that I think is very, very important to talk about is they are ACA compliant plans, but they are not ACA certified plans. To be an ACA certified plan, you have to be on the marketplace. These are private plans, but they look, feel, smell, taste just like an ACA plan, with one major exception that we'll talk about in a little more detail later, and that is that there are 11, I believe it's 11 questions to qualify for the plan. But don't be scared off by that, because those 11 questions are fairly don't impact most people. About 95+% of people can qualify for these plans. Another element of being ACA compliant is that any preventative medicine, your annual physicals, your mammograms, your colonoscopies, that kind of thing, they are at no cost beyond what you're paying for the premium. If you do go to visit a primary care physician office for some other reason, there is a $25 copay on the PPO plans. And if you go to see a specialist, there's a $40 or $45 copay, depending on which plan you pick. For those of you that have had an HSA, or perhaps are aware of how an HSA works, you do need to meet your deductible before you start to accumulate benefits. But your responsibility after hitting that deductible of $5,000 would be 20%. That 80-20 split for an HSA plan is very common in the corporate environment, and so that's why we wanted to structure it that way. As far as the value plans, it's $50 per visit copay. There are some maximums depending on with respect to that, but there are a whole bunch of different services. All the services available on the PPO plans and the HSA plan are also available on the value plans. If you kind of look down through there, you'll see physical and occupational therapy carries a $40 and $45 copay. Mental health, mental health and substance abuse is often a service that is excluded on private plans. That is not the case here. It is included. If you're of childbearing age and you need pre or postnatal office visits, that's $25 copay. And chiropractic. Many private plans exclude chiropractic, but this plan does include it with the $40 or $45 copay. Down at the bottom, you'll see a little bit about the telemedicine that's available from these plans. If you're on one of the value plans, there's no copay for the general medicine telemedicine. There is a $5 copay on the PPO plans, but the telemedicine also includes behavioral health at a $25 copay, or a dermatology consult / diagnosis for a $45 copay. So that's pretty nice. A lot of telemedicine doesn't include those components. Let's see. The other thing that people tend to be real concerned about when it comes to medical plans is my doctor in network? And this particular set of plans utilizes the PHCS practitioner and ancillary only network. This is one of the nation's leading networks of providers, and provide members with physician and ancillary providers across the United States. It's a national network. I would say, in my experience, this particular network probably has about 3 out of 4 doctors are in it. So maybe 75% penetration among providers. One thing that is very important about these plans is it operates as an open network. And what that means is that even if you do go out of network, go to a non-PHCS provider, the plan will still provide some level of benefit. Essentially, you would pay the difference between the in-network versus out-of-network rate. And also then the plan would, the copays and what have you would still apply. But if you feel like you really need to go out of network, it's not as if you're going to be completely out of luck and have no coverage whatsoever. Some other sort of characteristics or pieces of the plan is you may have noted that it's practitioner and ancillary only. What this means is there aren't hospitals technically in network, but you could flip that on its head and say, well, in a sense, every hospital is in network, because the way this plan works as part of its ACA compliance is in any case of emergency, this is a very important note, any case of emergency under the ACA, you can go to any ER or hospital and it's going to be treated as in network if it's an emergency situation. So, you know, when you're in the ambulance on your way to the hospital, you're not really in a position to be directing them to one versus another. And so one of the rules of the ACA is that you are going to have coverage, in-network coverage, no matter where you go across the country for an emergency situation. In keeping with ACA compliance, this plan provides that. Now, if you have a scheduled procedure, perhaps you're having a hip replacement, or you know that you need to go in and have some kind of imaging done or something like that, you would call the care guide at America's Choice. They would walk you through your various options and do a pre-certification process. And the options range from going to a specialty outpatient clinic that does just that procedure. Perhaps they only do knee replacements and that's it, all the way to going to your own hospital of your own choosing and negotiating directly with that facility prior to any services being delivered. And that's really important because in the case of going to a specialty clinic or a specialty surgery center, they tend to have much lower cost and much better outcomes because that's all they're doing. As an example, there's a facility that is contracted in Oklahoma City that just does hip replacements. And if you go there, there's three huge advantages. Number one, you're being serviced by somebody that's all they do all day is hip replacements, and the cost tends to be lower. The outcomes tend to be much higher, and your deductible can be waived depending on the procedure. So lots of advantages to doing that, but that is simply an option for you. If you do want to go to your own facility of your own choosing, America's Choice will pre-negotiate with that facility. And this is one of the innovations of this plan that we think is very beneficial to members, and part of the reason we selected this plan, because that pre-certification and pre-negotiation component means that you walk out of that hospital or walk into that hospital knowing precisely what your costs are going to be. I had a situation where I had a heart flutter and had a racing heartbeat. Went to the hospital to have a procedure done, and I just started post-procedure. I started getting bills. You know, probably within 2 or 3 weeks, I had a bill from the anesthesiologist. I had a bill from the hospital. I had a bill from the surgeon, and on it went. And I just kept paying bills, but I had no idea if I really should be paying them or not, to be quite frank. And if I had had this program, I would have known upfront exactly what my costs were going to be, and wouldn't have had any surprises. If the facility does bill extra beyond what was agreed to on the front end, there is a program that America's Choice institutes to negotiate on your behalf, to negotiate those particular charges away. So that's how the hospital coverage works. It's a little different, but we think it's an innovation that's going to be very valuable. Some other features of the plan. Teladoc is the partner that the plan uses for telemedicine. Teladoc is the leading telemedicine company across the US. And I talked a little bit about what that would be. Medalist RX is the pharmacy benefit management company. This is particularly beneficial if you have a specialty medication that you're on. Perhaps you're on Humira or one of those. This plan will utilize, to the extent that possible, patient assistance programs. They utilize drug importation, as you can see there. And some of those drugs are imported from Canada, some from New Zealand or Australia. But what we found is that the same FDA approved drug delivered to your door from out of the country can be as much as 80% less than if you were to buy it in the United States, just because of the way pharma economics work in the United States. With respect to medical imaging, I think I saw a statistic that the average X-ray in this country is about $800 and some if you do it in the hospital, and it's about $300 on average if you do it at a freestanding imaging center. This particular plan has partnered with Green Imaging, and they are across the country. If you don't have a Green Imaging local to you, they have a number of reciprocal arrangements. But the best bet is to call your care guide, talk to them about what procedure you need done, be that an MRI or a CAT scan or what have you, and they will direct you to the most cost-effective place to have it done, and that has been vetted for good care. And the next piece is with regard to diabetic solutions. I happen to be a type 2 diabetic, so this DiaThrive program is fantastic. Basically, you get diabetic supplies and order what you need. You'll have a full coaching platform for your diabetic care. We've talked about the pre-certification pricing. I mentioned the balance bill services. That's through a company called Claim Control Pro, and they will remove those balance bill situations from you and not cause you to have being sent to collections by your provider. I've mentioned the care guide several times. They're a central concierge service that's available through this plan. We think it's a very important component. These care guides are trained to help you utilize the plan as best as possible. They are available 12 hours a day to support you and your family as you pursue whatever situation you might need. It can be as simple as I need to know where the nearest pharmacy is to my home, all the way to, oh my goodness, I've been diagnosed with some form of cancer. What are the appropriate next steps? That care guide will get you the care that you need and direct you in the way to utilize the plan as best as possible. So with that, I'm going to turn it over to Stan. He's going to cover what we call the ancillary coverages. So starting with the dental and vision from United Healthcare and on through all of the other various coverages that we mentioned at the top of the presentation. Stan?
Thank you, Jim. I'm sure everyone's heard of United Healthcare. They'll be providing dental and vision insurance for the ExecAA for the year of 2024. It's important to note that you do need to re-enroll in your dental and vision for 2024. The dental plan is very rich. It covers expenditures up to $1,500 per person in a family, and that's going to cover everything from preventive to basic to even major services. Vision has some very low copays in the $10 to $25 range, and even gives you a nice allowance to use for your glasses of $130. Pricing for the dental and vision is a little easier than the medical. You'll see on the screen here that it's broken out by member, member spouse, member child, or a member family. And then on the right-hand side are the rates for the dental, and then below is the rates for the vision.
Monthly rates.
Correct, monthly rates. For those that want a little more detail on the dental side of things, the initial deductible for an individual or a family is $50 for the individual and $150 for the family. Your maximum benefit per person is $1,500 per year. So if you've got a large family, that's going to cover quite a bit of dental work. All of your preventatives are covered at 100%. That's oral evaluation once a year, bite wing twice a year, cleanings twice a year, fluorides and sealants. You can see it listed there. All that's covered at 100%. Basic is the next level up when it comes to dental care. That's going to be any kind of emergency treatments, simple extractions, oral surgery, periodontal work, and that's covered at 80%. Major, it's probably hopefully some stuff that you don't have to deal with very often, but it is inlays, dentures, and bridges, and all that is covered at least by 50%. Vision continues on with some of the rich benefits. There's a comprehensive exam that you can get done every 12 months. If you are diabetic, like Jim, you can go twice a year to get your eyes checked out. With the benefit also comes eyeglass lenses that can be updated every 12 months, and your frames can be done every 24 months with the allowance that I'll mention a little bit lower. Copays are $10 and $0 for the exam and the diabetic screening. Eyeglasses have a $25 copay, and contact lenses have a $25 also. Frames, as I mentioned earlier, the $130 allowance so that you can spend that wherever you want to. And the contacts have a little less at $105. So I kind of like this part, actually. So we've talked about dental and vision, and that covers almost everything. But what is important to think about is when life happens. And I like to use the example of there's 4 reasons you're going to go to a hospital. The first one is you're pregnant. The second one is you're visiting somebody in the hospital. And the third one is an illness. Maybe you ate some bad shrimp or some critical illness that I'll get to here in just a second. And the fourth one is an accident. And accidents happen 79.2% of the time, just shy of 80%. And that's if you slip, trip, fall. If you're like myself, last year I was trying to open a paint can with a screwdriver, being very manly instead of the correct tool, and I stabbed myself in the hand and had to go get some stitches at the emergency room. Or, you know, my own mother, 82 years old, was getting out of the shower and reached for the shower bar, but missed and got the towel and slipped and fell, and she broke her leg. Those are all accidents that can happen, and your medical plan is going to take care of everything to heal your body. What it doesn't take care of is you've got that deductible that we mentioned earlier on the plans, the $2,500, the $5,000. There's a maximum out of pocket of $7,350. An accident policy is going to be cash back to you to help pay off that out-of-pocket deductible. That helps lessen the damage that you've got out of pocket. Critical illness. So that was the third thing that I mentioned. Critical illnesses are there's the big 3: cancer, heart attack, stroke, the kidney failure, paralysis, burns, coma, loss of vision, loss of hearing. Those are all things that are involved in critical illness. And when you're in the hospital getting yourself healed, life still kind of goes on a little bit. You're still going to have car payments, house payments, apartment, groceries. It's nice if a critical illness policy pays you a dollar amount that you can then use to either pay off your pay off your deductibles, or you can use it to help pay some personal bills. Life insurance. Been doing the health insurance thing for a while, and I'm always interested when somebody says, I got life insurance, because it's not about the I, it's more about the family. One of the very early phone calls I received was a woman. She was looking for health insurance for herself. And I asked, why are you looking for health insurance? And I'd found out that her husband, and worked in the automotive world for a long time, was an angel. He took care of all the bills. He paid the house payment. He paid the car payments. He took care of everything. And unfortunately, what he did not take care of was himself. And he had a heart attack and passed, and did not have a life insurance policy. So this lady with her 2 kids was going to have to move, was going to have to get her own health insurance, was going to have to figure out how to pay off her cars because she couldn't afford her own house anymore. So here she was dealing with the grief of her husband, and now dealing with the grief of her whole life being upended. So a life insurance policy is not as much about the I, it's more about protecting your family than anything else. One good thing here to point out with this plan, it has a guaranteed issue of up to $100,000. And there's a lot of times when people, if they go straight to Mutual of Omaha or somebody like that, they can't pass the pre-certification that goes on there. And this plan, you can be guaranteed issue up to 100. So that's a very good feature to pay attention to. Disability. This is kind of, if you've injured yourself and it's going on longer than what you originally expected, maybe you've got some rehabilitation that you've got to deal with, and you can't work as long as you need to. The essentials of life are still going on, including, the cost of food, utilities, school tuition, whatever it happens to be. You are no longer in a working situation because you're injured. A disability plan will help fill that gap of the income that you've lost out on. Legal Shield. Legal Shield is the ability to have a lawyer 24/7 on speed dial on your mobile phone. And I allegedly, late running home one day, may have gone faster than the speed limit. And I have Legal Shield, and was able to turn a speeding ticket into a parking ticket. Which I found very advantageous. But what Legal Shield does is they have a long list of lawyers, all of them with 20 years of experience, with specialties in the real estate world, with landlords, with rentals, with traffic and accidents, and family law and finance. But what it is the ability to call and get connected with a lawyer immediately, and they're all vetted and very well placed in their fields. Identity theft. This is huge these days. 2.4 million people fall victim to ID theft. So, think about it. If all of a sudden your credit card's declined and you get a bill in the mail and it says you've bought crude oil in Alaska, and you're like, what's going on? Somebody's stolen your ID. Who do you call? Well, you call Legal Shield, and they have the people in place to help fight any charges that have fraudulently been brought against you. They help get your identification back and prove that anything that was taken is not theirs and it belonged correctly to you. And it's they're the people that you call to help prevent all that. Pet protection. I have 2 free pet rescues myself, and they have turned out to not be that free. I have had my youngest one, Bentley, he had an abscess tooth, and it did get extracted. And we were a little over that $831 number to get his tooth taken out. It also talks about swallowing bills and swallowing pet objects. So if you think about it, if you don't have pet protection, that's just straight out of your pocket that you're having to pay for that. With pet protection, you can get a large discount to help prevent some of those surprised bills that would come in. Okay, that brings us just about here to the end. So the next steps would be, if you're ready to enroll, I would encourage you to give myself a phone call. My numbers are there on the screens. I can answer any questions about the plans. I can send you, and I saw this in the chat a little bit, I can send you some benefit summary sheets that will answer almost all of your questions. I can send you the qualifying questions. There's 11 of them that you'll have to answer. You can look at those in advance before we go through any kind of enrollment. Once we kind of figure out which plan you think is going to best, then obviously you're going to select which ones, the 2,500, 5,000, or 5,000 HSA plans. Also, if you want to add on any accident, critical illness, life, or disability that we reviewed, or if you want to see more information on those, I can send that. And once we get through that, we're just going to set an enrollment day and date. Should take maybe 30 or 45 minutes. You might just go ahead and block off a full hour just in case there's some extra questions or some other things you want me to look up live while we're chatting on the phone. So, Jim, I think that about covers it on my side.
Absolutely. Thank you, Stan. I appreciate that. At this point, we still got some maybe 20 minutes of our session left to take some questions and answer what we can. You'd mentioned, Stan, there was some stuff in the chat. For some reason, I'm not seeing it, but maybe we could address those first and then open it up to questions from the audience.
Yeah, I'll read the questions that have already been submitted. Some of them maybe have already been answered. What PPO network is used, and the quick answer to that is America's Choice, but there's a second part to that.
PHCS is the network.
Yeah. Okay, so it's PHCS.
Yes.
The second question on the AC plans, are the cost of services negotiated the same as those for the PPO plans?
Yes, they are.
And then a follow-up to that question, is there any deductibles or co-pays for the AC plans?
$50 deductible, or I mean $50 copay, no deductible.
Okay. Last year, for those of you who are current members of our health plans, we were using Datego this year. So one of the participants asked, does this mean that Datego is not a provider in 2024?
Datego is actually the back end, so they're powering. It's still the same set of services. It's just they have partnered with America's Choice formally, and America's Choice is the front end of the plan, but Datego is still the sort of the back end third-party administrator.
And then I think Stan answered this. Where can we get a list of providers in our areas? When you set up an appointment with Stan, he can provide you with all of that information. Is that correct, Stan? Okay. Yeah. We also had a question. How would it work that the deductibles would be waived for pre-certified facilities and services?
Okay, I can address that. If you were to utilize one of the contracted specialty outpatient surgery centers, so if there's a qualifying procedure like a hip replacement as an example, or a knee replacement, and you were to utilize one of those facilities, you would receive the insurance would pay for your transportation to and from that facility, whether that be by air or what have you, for both you and your caretaker, so presumably a spouse or a friend or a family member of some kind that would be going with you. They will pay for your lodging while you're there, and then during your initial rehab, and then they would set up your rehabilitation back home for whatever was needed on the back end. And as part of that, to encourage you to take advantage of that lower cost, better outcome facility, they will waive the deductible.
The next question, if you go to a hospital on the value plan, and I think they're referring to the AC plan for, say, a broken bone, how much do you pay? So Stan replied just directly to them, just like a normal health plan, other than no deductible, and the plan is capped at 500,000 or 100,000, depending on which AC plan is there. But if you want to ask a follow-up question, just go down to the chat section and we'll try to answer that. Stan, was there anything that you wanted to add to that answer?
No, I think if someone gets the benefit summary sheet, that'll help add some more detail to them for them.
Okay. One of our current members asked, are the dental rates higher than they were in 23? And maybe a second follow-up question is, are the vision rates higher than 2023?
The vision did not change. The dental rates went up 7%, I believe. Is that right, Stan?
Yes, I think so.
Okay. The next question, does vision cover contacts or glasses, or does it only cover glasses?
Contacts are
It covers
covered.
both.
Yeah.
Okay. And some people may have arrived late, so they may have missed the answer. Next question, how are minor emergency clinics covered when you have an emergency condition but don't need the hospital emergency room?
That emergency, if it's determined to be an emergent situation, you're going to have that in-network coverage no matter where you go.
The next question, so enrollment will be done via phone only. Is that correct? Or and the answer to that is yes. What Stan or Jim will do is they'll kind of share their screen and they'll walk through the enrollment. It's actually done online, but you'll do it at the same time, kind of go through it at the same time rather than doing it online, by yourself. Stan or Jim, do you want to add to that? Or?
Yeah, the last year's process was very cumbersome. There was some health questions, then you had to get contracting sent to you, and then you had to fill out the contracting and pick the right plan. It was very cumbersome. We have America's Choice has highly streamlined the process. We've been through it with Jim Hogan. And it's correct. I'll just share my screen with you and we'll go down and we'll just kind of click along the right answers, answer the questions, fill in the payment, and we're complete.
Okay. We've got one more question. So if you've got any questions or comments or concerns, just go to the Q&A section. Or I guess if it's kind of a private question, you might want to save those when you talk to Stan on a more personal basis. But the next question is, with concierge services and the care guide, do we have the same person or will it be a different representative each time? Good question.
Yeah, it is a good question. I know someone who I've been in contact with, and they have had the same person each time. They've got a direct number to them.
Okay. And unless I missed something, I think that's the last questions. Let me just repeat. You can, if you go to ExecAA.com, ExecAA.com, that's the website for the American Association of Executives. We will post this recording and also the handouts to the website under the benefits section, you'll also see there's a couple of different options to join the association, and one of those options is a free membership. Along with that, you get included in our discounts and perks program, which offers a lot of discounts and things across the United States at like thousands of restaurants and venues. So there are some kind of benefits to joining as a free member, but not seeing any other. Well, let's see, I guess there's one more question. Will
There's
there
a few
be
more that have
portal?
popped in.
Yeah, will there be a portal for claims, provider search, out-of-pocket tracking, etc.? And Stan, I'll let you answer that.
Yes, they call it a PHD, your personal health dashboard. And I've seen it. And if you want to look at something like that after, I can either send you some screen captures or walk you through how one looks. It is pretty neat. You can also go on there and enter in, like if you got a Fitbit, you can enter in the number of steps that you took, or if you did anything, you wanted to track your health status, your weight or weight loss or something like that. It's got a whole area for that part also. It's pretty slick.
All right, Jim or Stan, any parting comments or advice?
I just certainly appreciate everybody taking time out, and certainly encourage you, if you do have any additional questions that you think of as you go forward, don't hesitate to reach out to that 866-306 ExecAA or ExecAA number, and have a chat with Stan or myself, and we'll get everything answered for you.
All right.
Now there's
Well,
a last question on when does
Go ahead,
open
Steve.
enrollment end. Hold on. Last question on when open enrollment ends. That would be December 20th or December. You make it December 15th. They like to have all of their paperwork in by the 15th of the month to have it go active the 1st of the month.
Okay. And just as a reminder for all of the individuals that are in families that are currently enrolled in the health plans, you will need to meet with Stan and decide which plans you want to move to effective January 1st. So be sure to do that. And we'll send a reminder email to those who are participating in the plans right now. But I appreciate everyone's time. Jim and Stan, thank you for your work and your time today, and we look forward to a new year.
Thanks, everybody.